People with Parkinson's, after some time with medication treatment, might also suffer some postural hypotension. That's a drop in your blood pressure when you go from, say, sitting to standing or from lying to sitting. And the symptom that you would experience is that you would feel quite dizzy. Some people might even have brief periods where they actually black out. Again, very easily countered, often by tweaking some medication around or teaching people strategies on how to manage this symptom, and it is very easy to manage. Often fatigue is part of someone's life with Parkinson's, and the medication therapy can occasionally worsen the fatigue that we're having. Again, if you're suffering those symptoms, you really should discuss them with your neurologist, and we can often counter them with maybe juggling medication timing around a wee bit more. Oftenly, quite a confronting side effect of medication treatment is experiencing some nightmares or some vivid dreams. And this often occurs at night time. Again, if you are starting to experience those symptoms, always discuss them with your neurologist. And whilst they can be quite difficult to treat, we can occasionally get some effect by using some other drugs that fall into the category of an atypical antipsychotic, such as Seroquel or quetiapine, and they can work quite effectively. The nightmares and vivid dreams can be a particularly disturbing symptom because sometimes when you're living with Parkinson's, you also have a REM sleep disorder where when you're in your deepest sleep or your rapid eye movement sleep, you in fact aren't paralysed as most people would be, and you might be acting out your dreams and thrashing about in the bed. So that can be quite disturbing both for you but also for your partner. Hallucinations can also occur related to medication, and what we do know is that about 33% of all people who are living with Parkinson's will experience some hallucinations from time to time. These can often be an auditory or visual hallucination and can be very, very faint or indistinct, but occasionally they can be quite confronting hallucinations. I always like to reassure people that no, you're not actually going mad, it is just a drug interaction. And again, something that we need to talk to our neurologists about, and again we might start to build in using some atypical antipsychotic agents, or it might be remedied by simply just changing some medication timing around. Often we might see some dry mouth, particularly with some of our dopamine agonists. If you are experiencing a dry mouth from your medication, some very simple precautions might be sort of in order, such as having some regular drinks. Fruit juices in particular are really good for keeping oral hygiene sort of quite nice and quite fresh. We can see some changes to our urinary system in developing some hesitancy and some retention. Again, very easily remedied by tweaking medication around a wee bit, and often timing of medication. And as you would have noticed, I'm sort of saying often we can fix them by changing times, which means often the end result of medication in Parkinson's is you're taking a lot of medication at many different times of the day, which can be quite difficult and quite challenging to manage. Which is why when we're actually talking about medication management, we would always suggest that you try and take your medication as your neurologist has actually prescribed it for you. And you might sort of look at it and think, gosh, he's got me taking something every couple of hours. But there is usually a really good rationale behind that because we're trying to counter some of the side effects and also get you sort of with the optimal level of motor coordination. However, what many people who've lived with Parkinson's for some time find is they might sort of, the neurologist is prescribing one way, but they will actually start to take their medication in another way. Sometimes it means that people are taking a little bit more medication or a little bit less. And most often that's fine, we're quite happy with that. However, we always like to know, so you should always report back to your neurologist about what changes you've actually made to your drug therapy. Because occasionally we can take a bit too much levodopa and we really want to monitor that situation quite closely. When you are talking to your neurologist, because you usually see them once or twice a year or every 3 months if you're lucky, it's always good to have a bit of a picture of how you've actually managed over that period of time. So maybe good to keep a bit of a movement diary, a bit of a diary about how you've been affected by your medication, what's been the good times, what's been the bad times. Don't keep it too extensive, but maybe just 10 or so days worth, just to give the neurologist a bit more of a picture about how you're performing with your medication. Often medications is a very complex issue when you've got Parkinson's, and quite often when we're prescribing we don't get it right first time, so it's always really good to actually have as much information to take back to your neurologist. And if you find struggling before you're due to see your neurologist again, don't be frightened to actually contact him to actually get some more advice around that. Alternately, you can always contact us at Parkinson's Victoria, and we're happy to discuss any medication queries with you. Sometimes we might be able to find a very simple solution for you, but often we might actually sort of say, no, this is a problem that you really need to take back to your GP or your neurologist. We're available at Parkinson's Victoria Monday through Friday, 9 to 5, or are contactable over the net. Our contact number is 1800 644 189, or you can get us at www.parkinsons-vic.org.au. Thank you.